Hello and welcome to this webinar on resolving complaints. Just a few things about the webinar. If you've got any questions, I'll answer them at the end. There's a place in the webinar where you can post your questions, so please put them there. Also, just a reminder that at the end, please fill out the feedback, and when you've done that, your certificate can then be emailed to you. The certificate should get to you early next week. So don't forget to do that at the end if you want your CPD certificate. What I'm aiming to do today is provide an update on how a practice can try and resolve complaints. We're looking at the importance of handling complaints effectively, trying to understand the obligations of the different members of the team when dealing with complaints. And this is anticipated to help with the GDC Learning Development Outcome A. A little bit about me. I'm Leo Briggs. I'm Deputy Head of the DDU. I've been a dentist a long time now, and I've worked in community, worked in general dental practice. I've got a master's degree in perio, and I'm a specialist in periodontics. And basically, I limited my practice from about 1996 to 2017 doing perio. I started working at the DDU initially part-time in 2005. I also did some work down at Portsmouth University, teaching hygiene therapy students there between 2007 and 2009. I went full-time at the DDU in 2009, but carried on working in a practice treating patients on referral because I loved it. I really miss clinical dentistry. Maybe one day I'll get back to it. But I became deputy head of the DDU in 2016, I needed to, something had to give, unfortunately, and it was the Saturday mornings in practice. So a little bit about the DDU. We are the specialist dental division of the MDU. We are run by our members for our members. So we are dental professionals for dental professionals, which is incredibly important. So all of us on the team have been or still are practicing dentists. We're all aware of the pressures and challenges faced by people when providing clinical care. We've sort of been there, done that, had the same sort of situations arise, so we understand what's going on. There's loads of information about resolving complaints and other dental-legal issues on our website, so please do look at it if you want additional information. It's a really good resource. And just phone up the advice line. That's what we're here for. We're here to help our members. So if ever you get a complaint, just phone us. And to bust a myth that's out there, using our advice line will not put up your subscriptions. Please don't believe everything you read. Just get in touch with us. The other place where you can get quite a lot of information about complaint handling, etc., are the ombudsman for the different countries of the UK. Even if you don't provide NHS care, it can be helpful information to see what is triggering a lot of complaints at the moment. What I'd like you to do is just think about, the last time you complained about anything. I actually nearly had to complain this morning. Having some building work done here, stuff was due to be delivered. Some of it was delivered, some wasn't. And we got a loose seat, which is someone else's loose seat, whoopee, and someone else's taps, not our ones. So, it makes you mad. And I didn't want to complain. I didn't, I was feeling fed up that I thought I was going to have to. But if I had complained, what I wanted was the incorrect stuff taken away and the right stuff delivered. So, it just makes you annoyed. But also just think the last time you complained about something, how well was it handled? And how did it make you feel if it was handled well? Also, what did you feel if it wasn't handled well? And use those same skills, use those same emotions. If you receive a complaint, think, I want to handle this well so that the person complaining doesn't get angry, doesn't get frustrated, doesn't get upset with the way I'm handling it. This is the current NHS definition of a complaint. It was written in 2017, fairly wordy. I actually prefer the slightly earlier one, which was from 1996, an expression of dissatisfaction that requires a response. It kind of frightens me how many people it took in a great long committee to change it from this one to the one that we've now got, but we won't go there. And just a few things about minor niggles. If somebody phones up or talks at reception about something that they're not happy with, resolve it swiftly. If you can resolve that within 24 hours, you don't need to handle it as a written complaint, as a formal complaint. And even if it is a more significant complaint that is raised verbally, if it's resolved within 24 hours, it doesn't have to be treated as a formal complaint. Just make a log that it was raised and how it was resolved. And that's it, it's done. Dusted, which is great. We always advise, don't tell people to put it in writing, because the trouble is they may well put it in writing, but they might write to someone else. And that means that you lose a level of control over it. And then I know this might seem counterintuitive, but if you're not sure if it's a complaint or a niggle or a concern, just ask the person. Say, is this a complaint? Would you like me to handle this as a complaint? I know that feels strange saying that, but actually very often people say, oh, no, it's fine. It's not a complaint. So make a note that they said that. And again, you've got it, you can get it resolved. The other thing to think about is what makes you angry. What sort of things make you angry? Service failures often make people angry. Trains not running on time. Food not coming in restaurants. Service failures are a common thing for people to complain about. Clash of personalities are another thing that make people angry. Being tired, the phrase tired and emotional. Being stressed often makes people angry because of the stress. Health, when you're unwell, you can often get more angry, and then you've got that particular nasty combination of fatigue, stress, and ill health. And many of our patients have got that. They're absolutely exhausted because they haven't slept because of dental pain. They're unwell because they've got an infection from the dental pain. And they're stressed about it. Just going to a dental practice is often stressful for people. So you've got that really toxic combination going on, which can often make people angry. And then failures to address complaints will often make people angry. And so the things that make us angry make patients angry as well. The sorts of things in dentistry which you put down as service failures are things like problems with the appointments, if they're incorrect, if they're not running to time. That's quite a common one that patients complain about, being kept waiting. And obviously, there are times where it's just not possible to run to time. But always try and keep patients informed if that's happening. If something's happened, you're running late, keep patients informed about it. You don't have to go into the details of why you're running late. It can just be something as simple as had to see somebody urgently earlier, so now running late. Treatment planning is something that I would regard as a service failure. It doesn't go according to plan. Now, again, every treatment plan will often need to be amended, but keep patients informed. Treatment failures, if it just doesn't work. In dentistry, we always think about how we have done things. Have we done it in the correct way? Not everything will always work. Patients are all about the outcome, and they don't really care how you did it and if you followed the correct procedures or not. They care whether it worked or not. So again, informing people that it might not work, letting people know the chances of it working or not, the consequences of it not working, that good communication is really important. And then complications are another service failure. Clash of personalities, we can't get on with absolutely everyone. You can always be entirely professional and polite to everyone, but you might not gel with some patients. And just think, how did I handle it? Did I wind them up? So just do a bit of reflection. And then stress, if we're stressed, patients will pick up on that vibe, and patients are often stressed just because they're coming to the dentist, also their own lifestyle, everything that's happening to them at that time. We have all treated patients who are normally fine, and they come in and they're on edge, and you start asking a few questions, and it's clear that they're going through an incredibly stressful time, and that might well be the thing that is putting them on edge. Fatigue as well, it can be us. If you are tired, you don't function as well, as efficiently as you normally would, and patients. And then health, it can be us, and it can be our patients. In dentistry, we tend to be dreadful about not giving up and turning up to work regardless. Sometimes perhaps we should take that step back and think, I'm actually not well enough to work. So again, it's because we don't want to let people down, but just be aware of the impact that your health will have on your ability to be able to treat people well. Why do people complain? Well, they often want apologies, and apologies are great. Apologies are free, and you will be apologizing all the time to your patients. Oh, sorry, that's a bit uncomfortable. Oh, sorry, I'm late. Sorry, all of those sorts of things are happening all the time without even thinking about it. It's fine. You're not admitting you are negligent. You are not admitting any sort of liability. You're just expressing empathy for the patient. So please don't worry about apologizing. And often an apology is all that a patient wants. They also quite often want an explanation. What happened? Why did it happen? Assurances. So if something did go wrong, they want to know what's going to be done to help prevent it happening to them in the future or to someone else. That can simply be something like, we've changed the way we book appointments so that the double booking that happened won't happen again. It can be something more serious. There have been some incidents recently that have been reported to us where the solution put in the water lines was incorrect. And so some practices have taken steps to ensure that that can't, or to try and ensure that can't happen again. You know, labeling bottles differently, that sort of thing, and providing that sort of assurance to the patient with the explanation so that they know they won't get burnt in future, or someone else won't get burnt by it. Remedies, they want things to change. You know, this is what I'm going to do to prevent it from happening. This is what I'm going to do to ensure that you're treated in a way that you're comfortable with in the future. Some patients want compensation. Now, it's important to realize that there's a difference between, from the technical point of view, from our point of view at an indemnity provider, there's a difference between a patient wanting a refund of fees and wanting compensation, which is for alleged negligent harm. Now, often patients will use the term compensation, and sometimes you need to tease out what do they want. Is it a refund of fees? You don't have to give it, absolutely fine not to, but if they want something like that, think about whether you are willing to give it, or whether you want to negotiate, or whether you think it's inappropriate to. Unfortunately, with the cost of living crisis, there are more patients wanting money back or wanting compensation because dentistry does take a significant chunk out of people's income sometimes. Whenever there's a downturn in the economy, there's an upturn in complaints, and there's an upturn in requests for recompense. I think this is the third downturn in the economy that I've been through since being here at the DDU, and every time there's an increase in the request for recompense from patients. Again, don't worry about it, just be aware that it's a bit more likely to happen when the economy is not doing as well. As I said, you know, you're getting complaints all the time, you're resolving them, you're learning from them without even being aware. You know, patients saying, oh, you know, I don't like you using that sort of equipment on me. Right, fine, I'll learn from that. I won't use it on you again. You know, it's all those sorts of things. You're always analysing what's happening, what patients like, what they don't like, what works, what doesn't. And so those are the skills you want to use if you get a formal complaint as well. Use those same analytic skills of how can I resolve this? How can I navigate this situation? And again, use us. Never be afraid to get in touch with us so that we can assist you, advise you about how to handle the complaint. Because what you don't want to do is be the captain of this boat. You know, you don't want to be the person who's there to shine a light on what not to do. It's rare in dentistry, but it does sometimes happen. So please don't be that person. And it is all about communication. That is the bottom line. Keep communication going. It's so important. This, I think, is a really interesting slide. Quite a chunk of complaints have got nothing at all to do with the clinical care provided, about a third. But I actually think, and I can't prove this in any way, but just through my experience of seeing lots of complaints, I think the non-clinical aspect is often the primary focus of a complaint and the trigger for the complaint, and patients will throw in a clinical thing to make it seem in their eyes more valid. So an example, you know, that they don't like the way they were spoken to at reception, which is actually their complaint, and then the tooth is sore afterwards. So they will complain about the tooth being sore and the way they were spoken to at reception. But actually, as I said, there's no way of me being able to prove this theory, but I am absolutely convinced that the non-clinical aspect is often the main trigger. So it is important that that is addressed in the response to the complaint, because actually, as well as any clinical concerns, because that will give you your best chance of resolving it swiftly. What happens if a patient's unhappy? Well, they might complain to the practice. It's not nice getting a complaint, but that's the best thing that you want. You want to know about it. Doesn't complain, remains a patient, but also remains dissatisfied. That is the worst option. And there's some sort of, I can't say evidence, but some information or sort of, information, I guess, out there at the moment, just that because patients are very aware that there is a crisis in NHS dentistry, they are less likely to actually complain at the moment. I know it doesn't feel like it to everyone, but they're worried about losing their place in an NHS practice. So, I think there might be more of these people out there at the moment, and that's a problem, because then there will be a straw that breaks the camel's back, and off they go. And you get all of their pent-up frustration, annoyance with everything that's happened over the last goodness knows how long, and it then becomes a really big complaint to handle. Be looking out for signs of dissatisfaction from a patient and try to address them early. Treat them as a minor concern, try and get it sorted. If they don't complain to the practice, they don't return and they go elsewhere, nobody wants to lose patients, but I'm kind of happy with that. It's if they don't like my style and they find someone they get on with, great. They're happy, they're getting care, I'm happy. I don't have to see someone I'm not getting on so well with, who I find stressful to treat, and haven't complained. So happy days as far as I'm concerned. That doesn't mean just get rid of the patients that you find a bit challenging to treat, because that will inflame them. But if they make that decision, if they choose to walk, fine. They might complain to someone else, and there's a whole heap of places where they can complain. It might be other patients, it might be solicitors, it might be to the NHS, it might be to the GDC, and increasingly it's online. So if you do get a negative posting, again, get in touch with us. We can advise you about how to respond to that professionally. Usually it's just we take complaints seriously. We have a practice complaints procedure. Please contact the practice, because often they're anonymous, so you don't know who they are. If you do know who they are, that's still the right way to do it, to say we will handle this through the practice complaints procedure, but get in touch with us. We can advise about the wording of those sorts of things. So why bother responding to them? Well, it's a good opportunity to resolve it so that it doesn't escalate. And that's really important, because you keep more control over it. It's also really helpful feedback, because you can think maybe other people aren't happy about this as well. Is there anything I can do to change things to make it better for others? And it's It's difficult to do that in the heat of the moment, but take the time afterwards when the dust has settled a bit to just think, actually, are there any things that we can do to change what we do to make it better for those who don't want to complain about it? Sometimes there is, sometimes there isn't, but take the opportunity to do that analysis. Also, organizations are judged by how well they respond to complaints. You know, the John Lewis test, I think, is the phrase that's used. It's also a GDC requirement that you have a clear and effective complaints procedure, and if you're in an NHS practice, it's also a contractual requirement under the NHS. So there's all sorts of reasons for why you need to respond to the complaint. Publicize your complaints procedure. Let people know about it so that they know how to use it. Always ensure that there's a person in the practice who is responsible for handling complaints in the practice. Communicate. Make sure that people know what's happening, how it's being handled. If there are delays, that's fine. And again, get in touch with us. We can draft responses, etc. Give you advice about how to inform people if there are delays. It should always be investigated. The depth of the investigation will depend on what the complaint is. The clinician should always be involved if it's about clinical care. It doesn't mean that they always need to write the response, although it's usually best that they do. Sometimes, though, especially if a patient has says, I don't want to hear from them, then they can provide a report which the practice can use in the response to the complaint, but the clinician is involved. And that's really important. Again, take action if there's anything that you think needs to change, and keep the records of the complaint so that you've got the numbers and you've got your data for how many there have been, you know, they've been resolved, etc. So make sure that you have the systems and procedures in place to handle and keep the data on the complaints. From the NHS perspective, there's common themes across all 4 nations. We don't have an NHS anymore. We've got 4 NHSs. Each country of the UK has a different NHS. It's one of the things that's been devolved, but complaints can be made by the patient, but they can be made by a representative of the patient as well. If it is a representative, check that they have the necessary authority for you to respond to them. Again, we can advise about that. There must be a complaints manager for the day-to-day operation of the complaints. Patients must know about the complaints procedure and make it freely available to patients. Again, you don't want complaints, but if someone is going to complain, you want them to complain to you. Again, patients can complain verbally or in writing, and then there might be the necessity for access to other records. You should have access to your records. If it's a clinician who was working at the practice, they would have had access to the records up until they finished treating the patient, so there shouldn't be any problems with them getting anonymized copies of those records. You might need the patient's consent for release of other records to them if that's needed for them to respond to the complaint. If you need records from another treating dentist, again, you might need to ask for that. Again, we can advise about that. And then something else that's important is that the complaints records are kept separate from the clinical records. Often it's all handled through the practice management systems, but they should be separate areas that they're stored in. If you are treating a private patient, again, there must be a practice complaints procedure, and it must be available to patients. The second stage of a private complaint is the dental complaint service, and that has been set up, is run by the GDC. They try to resolve complaints swiftly. And so if you do get contact from the dental complaint service, again, get in touch with us straight away. We can advise. They usually encourage you to get in touch with your defense organization. They try to mediate a response, or they've tried to remediate a resolution that both people are happy with, and that's that they put a lot of effort into trying to get that. If it's not possible, it can then go to a panel who then give their recommendations, but the DCS try to resolve it as swiftly as they can by using the caseworker as a mediator between the clinician or the practice and the patient. Patients might complain elsewhere, so just not come to the practice because they don't think it's worth complaining. So make sure that patients feel valued, make sure that patients know about a complaints procedure, make sure that if they're going to complain, they're encouraged to come to the practice first. They might complain elsewhere if they're unhappy with the outcome at the practice, but if you've handled the complaint well, if it does go elsewhere, you should not be criticized for the way you've handled it. And sometimes it's just that they do want money. So they're a bit more likely to go to perhaps a no-win, no-fee solicitor. So again, if it happens, it happens. Again, get in touch with us. If it is a claim, we will always try and defend it if we can. If we can't defend it, we will get your consent to settle it. But we have a very good track record of defending claims. So just because a patient wants compensation doesn't mean they get it. If they're not happy with the way you've handled the complaint, they might go to the Ombudsman for NHS Dental Complaint Service for private treatment. If you're part of a capitation scheme, DEN plan, something similar, they might complain to that organisation. They sometimes go to the GDC, they sometimes go to a solicitor. So, how to respond if you get the complaint. Make sure that everyone who's involved in the complaint is happy with the response that's going out. Don't just assume that they are. That's really important, that you ensure that all people are comfortable with what's being said on their behalf. You know, apologize, it's fine, you know, and it's you know, I'm sorry that this happened, I'm sorry that you found it uncomfortable, anything like that, absolutely fine. And again, if things could have been better, say so. That's not saying that you are negligent. It's just, yeah, that could have been done better. So it's fine. It's fine to say that. Again, what you've learned as a result of the complaint, if there is anything, obviously, if it's not that I don't like you and I don't want to see you again, you don't necessarily say that that's the lesson you've learned from the complaint. but there are other lessons that you might learn. And then, what are the next steps? Offer a meeting if you think it's appropriate. Patients should always be, and most complaints procedures give the patient the chance to have a meeting if that's what they want. The response to the complaint should always explain, if it's an NHS one, that there's the right of review of the Ombudsman. If it's private, you don't have to mention the dental complaint service right at the beginning of the complaint, only if you've got to the stage where you don't think you can respond further. The appropriate thing then is to signpost the patient to the dental complaint service. Common complaints, we've done quite a few of the service type ones, the attitude of people, costs are dentistry, the costs for us have gone up enormously. So those get passed on to the patient. Patients are aware of that. Then there's the sometimes complaints about consent. I wasn't told all the different options we sometimes see. If I'd known that, I'd never have agreed to it. Or sometimes you think, yeah, maybe. Sometimes you think, no, I'm not quite sure. I think that's using the retroscope inappropriately. And then sometimes it's the practice policies. It's that it's fine for you to keep me waiting, but if I don't turn up, you charge me. So those sorts of things can sometimes lead to complaints. With the treatment, it's a failure to diagnose and treat. It's pain either during or after treatment. So again, before you start, warn patients. If you warn someone about something and it doesn't happen, they think you're fantastic. If you warn them about something and it does happen, they're not panicking. If you don't warn them and then say, oh, that's a recognized complication, that's an excuse. If they're not happy with the appearance, if something fails, patients can be unhappy. As I said, with patients, it's all about the outcome. And endodontics is quite a common one for patients to complain about, because by its very nature, the tooth is a highly compromised tooth. It's also time-consuming treatment, no matter what techniques you use. It takes time. It's the one that patients dread probably the most. Most patients have seen Finding Nemo and know that classic scene with the fish talking about endodontics. So its root treatments have a sort of mystique about them, and there's lots of things that can and do go wrong with them, and so they can fail, and so they're being time consuming and expensive. So it's not really a surprise that it can be one of the things which leads to complaints. That doesn't mean don't do it. Of course you should do it if it's appropriate, but give the patient all the necessary information so they can choose if it is the right treatment for them. When responding to the complaint, analyze it. What's important? Sometimes patients write a lot, and sometimes you think, do I have to respond to all of that? No, actually, it's scene setting. It's giving their version of events, but you don't necessarily have to respond to everything they've raised in that. So that's where the analysis comes in. What is important? You should normally deal with all the concerns that they raise, but sometimes, just sometimes, it's better not to, because you think that's just going to inflame them. But again, we can advise you about that and advise you about how to respond to it. You know, what do they want? And if it's not clear, ask. It's fine, you know, and then you can decide whether you're going to agree or not. So that's always worthwhile finding out about, if you can. Don't hide. Don't procrastinate. Don't think, oh, I'm not sure what I'll do, so I'll do nothing. Ostrich position does not work with complaints. Don't argue with the patient. There are ways of setting out your version of events in using language that isn't argumentative, that sidesteps issues slightly, so that you're giving your alternative correct version of events without saying you're wrong. And again, we can advise about that. Never lose your temper, no matter how much you are goaded by a patient. Don't withhold facts or be economical with the truth. Never alter the records. If you've got a complaint and you think, there was more, I remember, just make a separate note in the information that you provide to us. Don't alter the records at all, because that looks dodgy, especially when it happens after the complaint has happened. If you do ever need to amend your records, sometimes happens, you know, you're on the way home, you think, damn, I've got to write that, go in the next time you're there, add a new note, make it clear why you're doing that addition to the record. Never refuse to compromise. Again, there are ways of phrasing that you don't think it's appropriate for you to agree to what the patient wants, but that's not a refusal to compromise. And don't try and respond on behalf of someone else. Very occasionally, you might need to set out what the records of another dentist or clinician have said, because they are no longer around and no longer contactable. So you might need to do that, but that is just reporting what the records show. You're not responding on behalf of them. Do deal with them promptly. Be accessible. Make sure that patients can contact you when there are complaints. Just be professional, be fair, listen. Explanations in plain English. That's easier said than done. We're using the jargon day in, day out. We forget it's jargon because we're surrounded by people who use the same words. Patients don't know what composite is. Patients don't know what amalgam is. Patients don't know what periodontitis is. Patients certainly don't know what a BPE is. All of those things that we just take for granted, we forget it's jargon. So using plain English can be easier said than done. Now, admit if something went wrong. Admit if there were complications. You know, it took longer than anticipated. There was a problem with the first lot of lab work, so it had to go back. You know, it's fine. Just admit it. Be empathetic. Express sympathy. Do be prepared to make changes. You can make offers to the patient. It's fine to do that. Again, it's not an admission of liability. Make sure that you're following the appropriate regulations for handling complaints. If it's an NHS one, the regs are slightly different in the different countries of the UK. Make sure that you're following the correct ones. So, you know, this is what patients want from it. They want a thorough investigation, they want easy access, they want it to be speedy, but that doesn't necessarily mean that you have to do it super fast. It's always better to get a good response out rather than rushing it and getting the wrong response out swiftly. They want honesty and they want no detriment. So you're not going to penalize them just because they've complained. And that's a really important aspect of the complaints procedure. You know, that's not what a patient wants from the complaints procedure. So agree what's going to happen with the patient. as I've said, admit the errors and mishaps and be prepared to say sorry. It is fine. It's absolutely fine. Get in touch with us as soon as you get a complaint. Always acknowledge promptly. The industry standard is within 3 working days. With your complaints procedures, always make sure it's got working days, not days. That buys you a bit of time. Easter's coming up, 2 bank holidays, not working days. So make sure that your complaint procedure always has working days for the timelines in it. Make sure everyone who needs to be notified is notified. So that's all the treating clinicians if they are part of the complaint. The reasoned response, and offer conciliation. If the patient is unhappy, try and mediate a successful outcome. So again, the GDC say it's important to have a complaints procedure, and it's important that everyone knows about the procedure and understand how it works. So make sure that that's built into the regular updated training that people have in the practices. Complaints procedures, complaints handling, it's that sort of thing where you want everyone to know what to do, but hopefully nobody have to use. But make sure that it is regular training that happens on it. And then, make sure it's displayed where patients can see they shouldn't have to ask for it, clearly written in plain language, provides information about other organizations patients can complain to, allows you to investigate, explains the outcomes, information that can be used to improve services, passed back, and respects patient confidentiality. That's an important thing. It's very easy to start responding to someone without the patient's consent. So again, get in touch with us. We can advise about how to work around that particular conundrum. And then you must respect a patient's right to complain. So that comes back to the no detriment as well. Don't react defensively to complaints. Listen carefully, involve them, and find out what patients want from their complaint. That's all there in the GDC guidance. And also must give patients a prompt and constructive response. Again, this is what they say in the GDC guidance under standard 5.3. Give them a copy of the complaints procedure when you acknowledge it, so they know the timelines, know how it's going to be responded to. Calm and constructive is the sort of language that should be used. That doesn't mean you have to agree to everything the patient says. There are ways of wording it that is constructive without rolling over. And again, we can advise about all those sorts of words to use. Then, deal with the points raised. So again, the GDC are just saying everything that I've covered already. So it's all there in the GDC standards. So how to try and avoid complaints from arising. I've already covered a fair bit of this, but it's communication. And this is what patients expect from us as far as communication is concerned. Again, this is from the GDC standards. When they developed the current set of standards, they did patient research, and at the section at the beginning of each of the 9 principles that we need to adhere to, there's a section on patient expectations. And this is what patients expect from communication, and all of it's absolutely fair. I don't think anyone would argue with that. If you're a patient, that's what you want from your treating clinician. So bear that in mind when responding to complaints, and also bear that in mind when trying to prevent a complaint from happening. Good communication is the bedrock of helping prevent getting a complaint. The difficulty is it's easier said than done. So it's just always work on it, work on how you sound, work on what you say. You know, that working hard at de-jargonizing, if there's such a word, that's probably jargon word, sorry, so that patients clear and understand, and check, double check, triple check. Most patients don't want to be at the dentist. Most patients are nervous about being there. Most patients will make all the right gestures, all the right sounds, all the right noises, as if they've understood, but it's not absorbed. And so it's our responsibility as the clinicians to check that they have truly understood. You know, and also it comes down to managing expectations. Now, as a periodontist, this is what I expect. You know, look at those gingival margins; they're wonderful. Lack of inflammation. You know, I think you can see the stippling from there. It's wonderful. Patients might not want that look though. And patient expectations changed. I've treated patients who all they have wanted when they first come is to save their teeth. If they do all the hard work, which I take the credit for, of course, and they save their teeth, then their expectations might change and they want to do something about the appearance of them. So keep up with patient expectations, especially in longer courses of treatment, in extensive courses of treatment. So always check what they're now expecting. Really important in orthodontics, because patients' expectations sometimes change. You've agreed, we're going to do this. They see the changes, they're happy with the changes, and they don't tell you, actually, what I want is a bit more. It's only when it comes to an end that they say that. So keep communication with the patients, because you don't want to be one of these headlines. You know, getting the Hollywood smile ruined my life. You know, so don't promise treatment which is not achievable. Be careful of the timeline. Build in the contingency plans, and then if changes are required, keep the patient informed. All of those things are fundamentals to good communication. And also, we've got to be aware of patients, what patients understand, what they believe. They often read things in the past, stuff in journals was exclusively for professionals. It might now be accessible to patients. Whether they have the knowledge to interpret it is another matter, but they might have read it and believe it. So it's important to be aware of that, because it can have a profound effect on them. You know, these things, teeth in a day, gold standard for full mouth dental reconstruction. You know, if they've read that and believe it and you don't offer that, they might be thinking, ooh, you're not the gold standard. I mean, I take exception with what that says, but I'm not going to get into that sort of discussion now. You know, it's that always go that extra mile. What's the extra mile for that patient? Is it a cup of coffee when they come in? Is it a chauffeur driven car? Do you know what that is? And also calm and soothing environment. Well, can you be sure that there won't be someone coming in that appointment with a screaming baby? That's then not a calm and soothing environment. You know, and just be prepared to say sorry. It's not an admission of liability. So onto the checklist now. Good communication throughout, act promptly, use common sense, seek advice early, apologize, and then think about any things that you can offer, and get help. You know, colleagues are a good source of help, practice owners, and us. And you know, you can help prevent them. Good communication, staff training, and then prevent complaints by managing expectations and being aware of your own limitations. And that's it. So if there are any questions, I'll end my screen sharing now, if I can remember how to, and see if there are any questions in the chat bit. Yes. Sorry, I'm finding this difficult to read. I need to try and expand that. Does DDU subscription covers letters to RDO officers in Scotland? Also complaints with other dentists, principal practice manager. If there's a clinical concern about the treatment you provided, we can provide you with advice if you're a DDU member. So get in touch with us. If an RDO has raised concerns about the care you provided, certainly get in touch with us. We can advise you about how to respond to that. If you've got concerns about a fellow member of staff, again, we can provide you with advice about how to handle that situation. Yeah, it's a not uncommon situation that people find themselves in. So yeah, any other questions there? Does DDU membership go up if they have had to write us letters for patients? I think that is. Our subscriptions are, the vast majority of our members pay the lowest subscription that we can offer for their category of membership. Our subscriptions are based on risk. So for example, if you are a dentist, your subscription is different to if you are a DCP because the risk is different, bearing in mind claims as well as complaints. And then there are some treatments which carry greater risk. For example, implants, we charge more for people who do implants. So those affect your subscriptions. There are a few members who are asked to pay more because they have a lot of issues with us. But the vast majority of members who we provide assistance with complaints, no, we don't charge more. Then there's another one here now. I think I can do this last one. Is it possible to decline treatment to a patient we feel can be trouble? Oh, that's quite a complex one. It's that you have to decide whether the relationship with the patient has irretrievably broken down. And again, that's always a really difficult, complex issue. So again, get in touch with us and we can talk you through about those individual situations, because it's not a yes, definitely, no, never. It depends on the situation and the circumstances. Sorry, that's not probably the answer you wanted, but yeah, I hope that helped. And then, yeah, you do get CPD. Remember, fill out the feedback at the end of this webinar, and then your CPD certificate will be emailed to you, hopefully early next week. I think that's it. I think my hour's up now. I hope that was helpful, and hope to see you soon.